Hello everyone, welcome to the Body and Medicine Secrets. Have you ever think that how doctors actually detect the diabetes with just a few number? Let's see the some diagnostic test for diabetes mellitus which helpful for detection of diabetes. So the test number one is urine test. Urine test is cheap and very convenient test, but this test does not give us fully idea about diabetes mellitus. Why? Here is the reason. So every individual has a different renal threshold. What is mean by renal threshold? Renal threshold means amount of blood glucose kidney allows to spill into urine. So this is called the renal threshold, and the amount of renal threshold varies in different individual. So individual with low renal threshold may have a diabetic test positive even if the individual is non-diabetic, and even the diabetic individual can get negative urinary glucose test because of this variation in renal threshold. So this is for urinary test. Test number 2 is blood glucose test. So what is done in this test is that a fasting blood glucose level is detected by pricking few drops of blood. Fasting plasma glucose level above 126 milligram per dl confirm diabetes mellitus. What is fasting blood glucose level? Fasting blood glucose level means level of glucose or level of sugar in the blood before eating something or before having the meal. Test number 3 is screening by fasting glucose test. What is done in this test is that fasting plasma glucose level is determined. Person above the age of 45 should done this test every 3 years. If the person is obese, then he or she should does this test earlier age. So this is about the screening plasma glucose test. Test number 4 is oral glucose tolerance test. This test is done for the patient with borderline glucose level, that is 100 to 140 milligram per dl. For this test, patient is instructed to eat high carbohydrate diet, high protein diet prior to 3 days of test. For this test, patient is instructed to keep fast overnight, and test is done next morning. Normal value for fasting blood glucose is 100 milligram per dl. So this is how diabetes is determined by oral glucose tolerance test. So these are the tests for determination of diabetes mellitus. With the help of this test, doctor determines whether the patient is having diabetes mellitus or not. So stay tuned for more such information. Thanks for watching.